Hi, my name is Carlene Ulacia, and I wanted to share with you something that if you didn't know, I really hope that you will know by the time you're done listening to this short message. In my experience, I have learned that many people believe that they have to have health insurance in order to get health care. No. Please know that that is not the case. I have been a life and health insurance agent for a little while now, and before that, I coached hundreds of insurance agents in onboarding them and getting them trained to support clients. And in that time, I've always taught them talk to the customer, talk to the client, find out what their needs are, and then look at all available options. I'm talking to you today because I want you to know something that is an industry secret, and it shouldn't be. I also want you to know that it is your basic human right to get health care in this country. Now, might it be the Taj Mahal care? Maybe not, but it is basic care that will keep you healthy. I cannot tell you how many people I have spoken to. There was one man in particular. It broke my heart. There are several folks. I talked to people with hypertension, diabetes, high blood pressure, for goodness sakes, even cancer, who are not reaching out to get health care because they think they can't. I am going to share, connected with this video, some resources to help you get health care. Now, in a perfect world, we would all have health insurance, but we don't live in a perfect world, right? We got to live in today with what resources we have. It's messed up that in this country, so many people don't have health insurance. It's crap. Agreed. But what are we going to do about it? There are local community health care centers that offer free or reduced scale, not assistance, but health care. If you go to urgent care, if you're in an urgent situation and unless you're, in imminent death, go to an urgent care center over an emergency room. You will still get treated. You will still get urgently cared for, but the cost is a fraction of what it would be if you go to ER. Many low-income folks go to ER because they know they won't be turned away. But there are other resources that you can tap on that won't turn you away and or will allow you to pay a fraction of the cost based upon your income. Many people, unfortunately, today have lost their health insurance due to furloughs or downsizing or a variety of factors. There are multiple levels where you can, multiple levels of health insurance that you can get access to, whether it be publicly provided or privately provided. And I will share in a future video on how to access those. But for right now, just get health care. I started to share an example. I spoke to a man, bless his heart. He had made up in his mind that because he had prostate cancer and have health insurance, he was just going to stay home and die. What? In this country? Oh my goodness. So I immediately looked up his local, I looked up 2 local community health care centers for him, and I told him about hospital benevolence funds. I also told him about the American Prostate Cancer Society. All of these sources are there to help him to get access to health care. And again, I'm making a very deliberate distinction between health care and health insurance. Know that they are different. If this video does nothing today but encourage you to get your mammogram, your colonoscopy, your whatever thing you need, your checkup, whatever thing you need because there's something gnawing at you making you feel like I need to go see a doctor, get it. Do it now. Your people love you. People around you want you to live a long, long time. It matters. You matter. Make up in your mind, and this is what I had to say to this gentleman, and some say this steps outside of the umbrella of what an insurance agent does, but basically an agent is about people. And what I had to say to this gentleman is, make up in your own damn mind that you deserve this care. I don't care what the system says. I don't care what health insurance companies say. The human rights in this country say that you deserve health care, but nobody's going to make you get it. You have to make it up in your own mind. And so often disenfranchised people, people of color, single moms like me, people of color like me, women like me, don't believe truly in our hearts that we deserve this care. So please, 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 please make up in your mind that you deserve it, that the people around you who love you deserve to have you with them. And look at the information I'm going to put next to this video. And stay tuned for my next video, which is going to be about the various levels of healthcare that are available in this country and how to access them. Excuse me, not healthcare, health insurance, whether they be free or low income or private or government provided. So as an agent, that's one of the things that I can do is help you understand the different levels. So therefore you can figure out which one's best for you. And then I'm also going to do a video around prescription drugs. Many folks, like I said, as you know, are losing health insurance. And there are ways to get your prescription medicines to continue your good health that don't have to cost you full price. So, oh, sorry, just knocked the little tripod. So stay tuned. Please share. Please comment. Let me know what you're thinking. If there's anything we should be talking about that you want to ask about, that you want to learn more about, that you want to share about. I'm hoping that this will be a community of conversation so that we can all lift each other up and claim our basic human right of decent health care. I do this with love because I feel impassioned that our human rights, it's not fair. Black lives matter, Asian lives matter, Latino lives matter, white lives matter, all lives matter. Love you. Bye. See you soon.